October is Breast Cancer Awareness Month, and today we're learning about the different treatments out there. There's so many. Here with more is Dr. Farhan Imran from Rochester Regional Health. Thank you for being here. Good morning.
Pleasure to be here.
When someone hears that diagnosis or that phrase, you have breast cancer, it's still scary, but there was a time that it was thought of as a death sentence. Not necessarily the case anymore. There is hope out there for people who are diagnosed in terms of treatment. What are some of the ways that people can be treated? What are some of the advances in technology that is giving people hope?
Your message is absolutely right. There's just a lot of hope in breast cancer now. If you look at the prognosis curves and mortality curves, they have improved tremendously. And thanks to multiple advances in the field of breast cancer, it starts off with early detection. More and more cancers are now being detected early. We are able to do a lot about that. So all the women should go out there and make their appointment to have that mammogram today. Then surgical techniques have improved tremendously, and specifically, I think we've covered this here before, but we are the first in the region to bring in what is called intraoperative radiation therapy, where the radiation is done right at the time of the surgery, and one big step of the journey is taken care of. And then there are so many advances in the medical oncology aspect of breast care. This includes, within the last couple of years, specific testing of the tumor tissue for these gene panels, which are very specialized tests, which give a scoring system to the cancer. And because of those tests, so many women have been able to avoid chemotherapy, which is also a very big deal in this treatment. And then lastly, for women who are diagnosed with advanced breast cancer, or so to say stage 4 or incurable breast cancer, that is also very well managed nowadays. And within the last couple of years, several new oral molecularly targeted pills have been studied and have had good outcomes. And immune therapy, which has been a success in a wide variety of cancers in oncology. Some of the most aggressive kinds of breast cancers, called triple negative disease, immune therapy has shown improved outcomes in that as well. Wow. So it's hard to cover everything within this scope, but there's a lot out there for breast cancer.
Once a woman or man gets that diagnosis, then doctors move to personalize or tailor their care. How does that work, and why is that so important in their treatment?
So the reason it's so important is that we often hear women coming and saying, my aunt or my sister or my cousin was treated this way, can I also be treated this way? What personalized medicine is that every time any woman gets a cancer, and once the surgeon takes it out, it is submitted to the pathologist, who runs so many tests on it. And not only do we see what kind of cancer it is, but we see what are some of the different characteristics, like hormone receptor status, HER2 molecule status, and so many other tests. With that, the treatment is really personalized or tailored to that individual patient. And that is done for each and every patient. And with that, we have a number of different options of treatments. So no two cancers are alike, and every individual cancer is treated in its own way. That is what the personalized medicine is.
Wow, we were having a different conversation maybe 10 years ago. I can't imagine what we'll be talking about maybe 5 years from now with all the advancements in technology.
That is the big hope. Already, like you said, if you look at 10 years ago, or if you look at 20 years ago, those treatments now appear almost archaic. And now, hopefully, we are moving towards a chemotherapy-free world of oncology. I don't know when, but I hope to see that in our lifetimes.
Wow, and I hope we're talking about it with you when that does happen, and that's soon.
Well, who knows?
Well, Doctor, thank you. Great information, and it really is remarkable the progress we've seen in the last few years.
Absolutely.
Thank you for your time this morning.